All right, 30 seconds. You guys ready?
Yeah.
Woo! We got our camera? Yeah. Multiple angles, and if you could do close-up, headshot, and then wider. Okay.
I'm just gonna move these bags over to the side.
And is this stuff in the? Is this in the way? What do we want?
Medicare for all!
What do we want?
Now!
10 seconds. Okay. All right, you guys ready? What do we want?
Medicare for all!
When do we want it?
Now!
What do we want?
Medicare for all!
When do we want it?
Now!
What do we want?
Medicare for all!
When do we want it?
Now!
What do we want?
Medicare for all!
And when do we want it?
Now!
Brothers and sisters, good morning. My name is Joseph Givargis. I'm the National Director of Our Revolution. We're here today live at the United States Capitol. It's the latest stop on Our Revolution's Medicare for All Emergency Ambulance Tour. Give it up for Our Revolution. Woo! We launched this ambulance tour because there is a national medical emergency in the United States of America. Every single day, 123 Americans die because they lack health coverage. Is this the American dream?
No!
No, it is not. Every single day, 1,600 families are forced to declare bankruptcy because of medical debt. Is this the American dream? No, it is not. That's why Our Revolution is traveling the country in this ambulance, calling on the Democratic-controlled House of Representatives to pass Medicare for all right now. What do we want?
Medicare for all!
When do we want it?
Now!
What do we want?
Medicare for all!
When do we want it?
Now!
What do we want?
Medicare for all!
When do we want it?
Now!
Brothers and sisters, the truth is Medicare for all is a popular issue among the grassroots of the Democratic Party. In fact, a recent poll shows that 82% of Democratic voters support passing Medicare for all and extending the fundamental right to health care to every single human being. But here's the problem. Not every single Democrat in the U.S. House has yet to sign on as a co-sponsor. Shame! And that's why over the last 2 weeks, we've driven our ambulance to the districts of over a dozen U.S. representatives in states like Maryland, New Jersey, Ohio, and Illinois to call on our representatives to stand with the people and sign on to Medicare for all right now. And we are here today because we are bringing those stories from the tour to Capitol Hill. One of our local Our Revolution members shared her story with her congressman in New Jersey. She talked about having postpartum depression, but was unable to get the therapy and counseling she needed. Is that okay with you? No. One of our leaders, Rachel, who is with Our Revolution in Illinois, talked about how she was afraid to leave a domestic violence situation because she was afraid she would lose coverage under her husband's health care plan. Is that okay with you? No! No! And Anthony from Toledo, Ohio, shared how his family was forced into bankruptcy and lost his home all while he was a little child because his father suffered a major medical emergency. Is that okay with you? No! No! And that's why our revolution is here to deliver a message to Congress. No more incremental change. No more incremental change. We need to make sure that we transform our broken healthcare system. We need to make sure that every American enjoys the fundamental right to health care. We are here to tell members of Congress, those Democrats who are bankrolled by the pharmaceutical industry money and by insurance company money, that they are on notice. We need them to stand with the sick and suffering, not the rich and powerful. We're going to be joined by U.S. Representative Pramila Jayapal, the author of the Medicare for All Act of 2019, in a few minutes. She is on her way to a historic hearing that's going to be happening in the United States House of Representatives Ways and Means Committee, and we're honored to have her present. But before we hear from Representative Jayapal, I want you to hear from some of our local members and healthcare providers who are struggling to navigate this system. And before I introduce them, I want to urge all of you who are watching across our great nation to join our movement. In order to build the political revolution, we need all of you. We need all of you to stand in solidarity with us and take action. And here's how you can get involved. You can pull out your phone and text M4A to 83224. Again, M4A to 83224. Become involved in our movement and let's hold centrist Democrats' feet to the fire. What do we want?
Medicare for all.
When do we want it?
Now.
What do we want?
Medicare for all.
When do we want it?
Now.
It is now my honor to introduce an Our Revolution leader from Howard County, right next door in Maryland, Roxana Segovia Beltran. Give it up.
Hi everyone, my name is Roxana and I'm originally from Southern California and I'm on the steering committee of Howard County Our Revolution. I'm here because I was raised in a very awkward income level as a child where we couldn't afford health insurance, but we didn't qualify for Medicaid, so our only option was no health care for you. So when you're raised with this situation, you kind of have to have this mentality of wait and see, right? You just can't, if you're sick, it's like, well, we have to wait and see if you're going to get better because we can't do anything for you. And if you're really, really sick, well, then now we saw what happened, right? So I was really lucky because I was actually a pretty healthy child, but when you take risks, eventually it catches up to you, and it caught up with me because when I was in the university, I was about to graduate. I was so excited, and it was finals week, and I'm studying for like my last semester for university, and I eat bad fish. So my throat gets itchy, and I'm like, oh, okay, this is weird. And it starts closing up, and I'm like, wow, this is a problem, but I'm just going to take a nap and wait and see what happens, right? Because at that point, I didn't think I need to go to the doctor. So my boyfriend, now husband, comes up to me and he says, you know what, I think you need to go to the emergency room. And I said, no, I can't do that. Like, I'm going to graduate into debt. I can't afford any more debt, so I'm just going to wait and see. So at that point, he's like, no, this is really bad. Like, your throat's closing up. You need to go. And I said, no, that's impossible. I cannot go to the emergency room. This is not an option for me. So he actually takes me kicking and screaming. So I go and I show up and I say, hey, like, can I just go home? It's just, I can't breathe, but it's fine. Like, I just need to go home. And they say, oh, you can't breathe? You need to go inside. So they sit me down, they stick me with epinephrine, and they say, we saved your life. And I say, how much is this going to cost me? At this point, I could not think about my life being saved. All I could think about is how much more debt am I going to accrue now? How am I going to, it's 2010. We're like in a recession. What's going to happen? My mommy don't have money. There's no one out there that's just going to give me money for this. So I look at my options once I actually get my bill. And what was my option? I called, say, hey, you know, can I put this on a payment plan? And they said, well, we'll still send you to collections. That was my option.
That ain't right.
So what I had to do, I had to get my credit card, put it 20% interest. It took me 6 years to pay that. So the story here is not about poor me. The story is about how this is everyone. This is not just me. This happens every day to so many people, and I'm the lucky one because I survived. And we've had people in our family that weren't so lucky. We had a cousin, horrible stomach pains. I need to go to the ER finally. So he shows up, oh, you have stomach cancer. And it's so far along, there's nothing you can do. But had you gone for your wellness visit, we probably could have done something for you. A few weeks later, he was gone. So this is not okay. We're the richest country in the world, but yet we're just dying. Because people are making money off of our pain. They're making money off of our suffering and our death.
That ain't right.
And we can't have that no more.
That's right.
So that's why I support Medicare for all.
Yeah. What do we want? Medicare for all. When do we want it? Now. What do we want? Medicare for all. When do we want it? Now. It's now my honor to introduce a student leader, Jake Burdett from Salisbury University. He is the co-president of SU College Democrats, and he is a symbol of the next generation and what they want our world to look like when they enter the workforce. Give it up for Jake Burdett. Woo! What do we want? Medicare for all. When do we want it? Now. What do we want? Medicare for all. When do we want it? Now.
Thank you. Good morning, everybody. I'm here in Washington today to strongly urge the Ways and Means Committee to let the Medicare for All bill go through committee with a favorable report. Yes. Several of my fellow students, a few of which are also members of the Salisbury University College Democrats, have experienced serious health emergencies. These students were lucky because they were born into families with decent health insurance. If they hadn't been, they could have lost their lives or bankrupted their families. It's an unfortunate fact that nearly 44 million Americans aren't so lucky. They still don't have insurance, even under Obamacare. Right now, there is a moral imperative to pass Medicare for all. Nearly every other advanced country has had a single-payer healthcare system for decades. It's time for us here in the United States of America to move past our barbaric system and modernize to the global standard. I've heard people ask how we will pay for Medicare for all. But the real question for me is how can we continue to pay for our outrageously expensive current private healthcare system? Research has shown that it would actually be less expensive to switch to Medicare for all. In fact, even a Koch brother-funded think tank study found that our country could save at least $2 trillion over 10 years with the Medicare for all system. The reason for the savings is simple. Healthcare is a necessity. Therefore, the typical supply and demand laws in a free market don't apply because the demand for healthcare does not change significantly with price increases. It's a necessity. People need it. They will pay whatever they get charged with, and that's what the for-profit companies do.
That ain't
What that means in our current reality is that for-profit insurance providers can charge practically whatever they want, and people have no choice but to pay for it. There's no reason to be against Medicare for all. It would cover everyone, it would save money, and it actually provides better health outcomes. We need Medicare for all, and we need it now. There is no excuse. Thank you, everybody.
Everybody in!
Nobody out!
Everybody in!
Nobody out!
Everybody in!
Nobody out!
Everybody in!
Nobody out! Hi, my name's Chrissy Holt, and I'm a mom from Annapolis, Maryland. And 24 years ago, my son was born with a pre-existing condition and uninsurable with severe hemophilia A. And it was at that point in my life that I knew that policies were going to affect my everyday outcomes, particularly to keep my son alive. Hemophilia is a genetic bleeding disorder, so his blood doesn't clot normally, and he needs to take medication every other day, and the cost of that medication is $35,000 to $45,000 per month. I can't get access to that medication until I pay over $6,000 in my premiums and $5,000 in his copay and a $10,000 catastrophic. I am sick of Congress people telling me that we like our insurance companies. We don't like them. I've been fighting them for decades to be able to get health care for my son. Parents with chronically ill children, we live in constant fear of losing our children and losing our livelihood with terrible outcomes because insurance companies deny the access to the care that our doctors are prescribing. The great American capitalistic healthcare system is another form of systematic discrimination based on diseases, and it's not right in America. There's ample money for everybody in the healthcare system to be able to get access to the care that they need. My son in 2 years is going to roll off my insurance plan. His current DC employer does not provide a healthcare plan that's going to pay for his access to his medication. So what is he supposed to do? Change jobs, move, die because he doesn't have access to his medication? He deserves the right to have access to his medication so he can be gainfully employed. So many of us are underemployed and underinsured, and we don't have access to the medication that we need. We should not even have to be asking these sort of questions today. There's enough data out there to prove that there's enough money and enough care so that we can all live good lives today. We need Medicare for all. There is no more dispute. Anybody who is not voting for Medicare for all is on the wrong side of this civil rights, of this human rights argument. The time is now for everybody to be on the right side of history. Thank you.
Everybody in!
Nobody out!
Everybody in!
Nobody out!
Everybody in!
Nobody out!
It's now my honor to introduce Dr. L.E. Gomez. Actually, before we do that, we're joined by a special guest, United States Representative Pramila Jayapal. She is the co-chair of the Congressional Progressive Caucus. She represents the great state of Washington, and she is leading the fight for Medicare for all in the U.S. House. Give it up. Thank you, sister.
Thank you. Hey, everybody, listen. I'm not leading the fight for this. You are. You are. This is a people's movement to make sure that we get universal health care for everyone, and it is the people across this country that are demanding health care as a human right. And so the work that we have is to continue that organizing, and that's what the ambulance tour is doing. We have half of the Democrats in the House of Representatives as co-sponsors. We now have the third hearing in the House of Representatives. And you know, when we started this, people were like, oh, you're only getting a rules hearing. You're not going to get a hearing in the committee of record. Well, historic, today, we have the first ever, not just in this cycle, but the first ever in the history of the United States, a hearing on Medicare for all in the Ways and Means Committee. And that is because people have organized around the country. And this tour is important because we need to help people understand that it is good to be courageous, even though coming out for Medicare for All is not just courageous, it is the right thing to do. It is the thing that is done across the world in other peer industrialized countries. They have this kind of a system. We too can have it. And so today we will have another opportunity to make our case, not just to the American people, but also to my colleagues in the House. I will tell you that we have already made progress. We have gotten more people after the last Budget Committee hearing. We are set to announce another high-profile co-sponsor shortly. And there are more people that are telling us that they are ready to follow the lead of the people, to be courageous, to lead, not just to follow. That is what our job in elected office should be. You are helping us to do that. I got to go to the Ways and Means Committee hearing right now, but I hope that people are going to tune in and watch this, because it is really important for people to understand what Medicare for All is. Not everybody does. Now, I know you guys do. I know that you understand what it means for everybody to be in and nobody to be out. And I know that you understand, and we need the people to understand what you get with Medicare for All, right? What do you get? You get comprehensive care. All the care that you need. Mental health, vision, dental, reproductive care. When you get sick, you get to go to the doctor. You do not have to rely on GoFundMe as your primary insurance plan.
That's right.
What else do you get? You get to have any doctor or hospital that you need. In fact, you get more choice than what you have right now, because there is no out-of-network doctor or hospital. There is no surprise billing. You actually get to see and get the care that you need. What else do you get? You get long-term supports and services. If you're somebody with a disability, if you're a senior, you get the care you need. So, okay, I'm getting the sign. I got to go to the hearing. So I'm wrapping up now. And I want to say thank you to the ambulance tour. Thank you to everybody out there that's going to help us make this a reality. Let's go do it. Let's win. You ready?
Yeah! All right. What do we want? When do we want it? What do we want? When do we want it? What do we want? When do we want it? Thank you, Representative Jayapal, for your leadership on this issue. We need more progressive elected officials to stand with the people and not large corporate interests. And that's what our revolution is about. We are building strong grassroots organizations to elect progressive candidates at all levels, from school board to President of the United States, so that we can win on progressive issues like Medicare for All. For all of those of you who are watching, join our political revolution. Text M4A to 83224 to join our movement. It is now my honor to introduce Dr. L.E. Gomez. He is a professor at Howard University Medical School. And not only that, he was with us at our kickoff for the emergency tour in the district of U.S. Representative Steny Hoyer, who is the House Majority Leader and an obstacle to progress. So give it up for Dr. Gomez. Woo!
My name is L.E. Gomez, and I'm an emergency physician. Not a physician for rich people, not a physician for poor people, but a physician for every patient that needs critical care. I didn't choose this career to serve shareholders or line the pockets of people putting profits over patients. I didn't come from money. I understand it's not what makes us valuable. My parents were immigrants who fled oppression to become U.S. citizens. I was the first in my family to attend college. My mom was a sweatshop mender. My dad worked on the docks. I got my education in public schools. My medical care came in at public health clinics. Public school teachers taught me how to escape poverty. And I got scholarships at college because brave people like the activists you see right here created those scholarships. I went into medical research as a way to pay it back. And then I left academia for medical school when I realized that biotech was more interested in profits than people. Most doctors don't go into medicine for any other reason than to care for patients. Not push paper, not bill. Most doctors want to advocate for their patients, not fight corporate greed or manage care for the right to advocate for patients. Because unfair contracts deny us control of who gets billed what, while we end up getting paid a fixed salary and corporations squeeze more money out of patients by cutting corners to maximize profits. And I know this because I went to business school to learn what drives these people to get rich off of the sick and needy. It's because many of them never heard of a calling. Most of them don't know what that even means. You know how we pay for Medicare, universal health care? By eliminating the profit motive. By not spending our tax dollars subsidizing third-party payers.
That's right.
By making sure that the money is spent to pay the people that are actually giving the care, caregivers.
That's right.
Not administrators, not billers, not coders, not middle managers. Let's use our tax dollars to care for the sick, to keep people healthy. Rich or poor, black or white, Jew or Gentile, all Americans deserve guaranteed medical care.
That's right.
Thank you.
What do we want? Medicare for all. When do we want it?
Now.
What do we want? Medicare for all. When do we want it? Thank you, brother.
Thank you, Doc.
Give it up for Dr. Ellie Gomez. You know, the truth is a lot of medical professionals, doctors, and nurses are afraid to speak up about a broken healthcare system because they're afraid of retaliation, right? Large healthcare companies like the system as it is. Large insurance companies and pharmaceutical companies like the system as it is because it lines their pockets. And doctors and nurses and other frontline caregivers are often too afraid that they will face retaliation. I want to thank Dr. Gomez and all the doctors who joined us on our emergency tour stops around the country. Right now, we want to introduce to you a dear friend. His name is Chucky Dennison. Chucky was a worker at the GM Lordstown plant in Ohio. That plant recently shuttered its doors, even though Donald Trump promised to save the plant. 5,000 workers have been laid off.
That ain't right.
That ain't right. And that community has been devastated. And it's not that they just lost their jobs. They have lost their health care. Because in our country, health care is tied to employment. That ain't right. And so when corporate America decides to put profits over workers, right, end up on the streets without a basic right, which is the right to health care. I want to bring up Chucky Dennison. He is not only a former GM worker, he is the leader of our revolution in Mahoning Valley, Ohio. Give it up for Chucky.
I'm here. Medicare for all.
When do we want it?
Now.
What do we want?
Medicare for all.
When do we want it?
Now. Yes, I'm here representing our revolution, Mahoning Valley. I'm here representing those folks who have been laid off in our valley, our brothers and sisters of the UAW. Cobra, to pay for Cobra, $1,300 a month. I'm here to represent Robert Morrison from Iowa, whose 31 years of service at a factory got shut down. He is paying $700 a month.
That ain't right.
That ain't right. Our brothers and sisters from South Bend, Indiana, UAW retirees whose health care has been attacked. That's not right.
That ain't right.
No one in America should have to go without health insurance or be able to see a doctor when they are sick. Our health insurance should not be tied to our employers.
That's right.
Health care is a human right, and we will not give up fighting until we pass this Medicare for All bill. So Democrats, it's time to sign on and get this passed and do your job and what you were elected to do, and that is represent the American people and tell the insurance companies to take them checks and tear them up. You don't want them.
That's
Your
right.
job is to represent the American people, and it's time to start doing it now.
That's right. What do we want?
Medicare for all.
When do we want it?
Now.
What do we want?
Medicare for all.
And when do we want it?
Now.
Thank you, Brother Dennison. And Brother Dennison is not only a leader in the fight for Medicare for all, he's also a leader in the worker resistance. Donald Trump ran as a worker champion. He promised Midwestern workers he was going to deliver more jobs, better wages. He promised he was going to stop offshoring. He's failed to do so. And Chucky and other workers across the Midwest are organizing to hold Donald Trump's feet to the fire, right? Because we won't allow any more false populists to get to the White House. We want true populists who champion progressive issues, who stand up for worker rights, who stand up for healthcare rights to get to the White House. Woo! Right now, that's right. Right now, it's my honor to introduce another student from Salisbury University. She's a young activist. Her name is Emma Shankman. Give it up for Emma Shankman. Woo! Woo! What do we want?
Medicare for all.
When do we want it?
Now.
What do we want?
Medicare for all.
When do we want it?
Now.
Hi, I'm Emma Shankman. Medicare for All is an important issue to me because I was born with Turner syndrome. It's a rare genetic disorder that means that half my chromosomes were dead when I was born. One of the major effects of this is my heart was deformed because I was missing the chromosomes needed to fully form my heart. I was lucky enough that my dad is a federal worker. He actually works here in Washington, D.C. And I don't know if everyone knows this, but some of the only jobs in the country that offer full health care coverage are actually federal workers, or people who work directly for the U.S. government. So my family was in the club, and my life got saved because my dad is privileged. And I also understand that if I had been born into another family, or had my dad not made the choices he had to have the job that he has, I wouldn't be here. You know, the other day, this is kind of confirmed by my mom. I asked her what she would have done if we didn't have insurance, and she said, well, then you'd be paying it off for the rest of your life. But that's probably not true. I mean, my surgery cost $100,000. There's no way that they would have been willing to do that if we didn't have insurance. It just doesn't work like that. I also know that the quality of life I have now is can be greatly attributed to our insurance. I have to take a lot of medications to replace the hormones that my body can't make because of my condition. I know that if I were not to take these medications, if I had to go without, I would have no quality of life. One of the hormones my body can't make is the hormone that regulates emotions. So there's no way I could survive without that. Without it, it's pretty miserable. So I also know that so much of my privilege is because my family is white and middle class, and my life is worth no more than anyone else's because I am white.
That's right. That's right.
So I believe that this is an issue not only for the poor, but also for anyone who's disadvantaged because of the way they were born. So healthcare is not just an issue for the poor. It's an issue for people of color. It's an issue for women. It's the best way, the easiest way that American people, the American government, systematically abuses people who are not privileged, and that has to stop now. Thank you.
What do we want? Medicare for all. When do we want it? Now. What do we want? Medicare for all. When do we want it? Now. Thank you, Emma. And we're about to wrap up our emergency ambulance tour stop right here in the nation's capital. The U.S. House Ways and Means Committee is about to start a hearing on Medicare for all. Momentum is growing. More and more members of Congress, Democrats in Congress, are signing on to the bill. But we need to get the rest of them. We control a majority of the U.S. House, yet not all Democrats have signed on to Medicare for all. So you need to get involved, brothers and sisters. Do more than once. Get involved in our fight. Text M4A, M4A. We good? Are we cut? Cut. Oh, sorry. So text M4A to 83224. M4A to 83224. I want to also do a shout out to all our local Our Revolution leaders who have made our emergency ambulance tour a success. In the last 2 weeks, 3 or 4 new members of the House have signed on because of grassroots activism. So I want to give a shout out to Our Revolution Maryland, Our Revolution Virginia, Our Revolution leaders in Illinois, Ohio, New Jersey. To all of you, I say thank you. With your help, by fighting together, we will win the political revolution. We will transform our society so that every single human being enjoys the fundamental right to health care. Thank you for watching this program and join our movement. What do we want?
Medicare for all.
When do we want it?
Now.
What do we want?
Medicare for all.
When do we want it?
Now.
What do we want?
Medicare for all.
When do we want it?
Now.
What do we want?
Medicare for all.
When do we want it?
Now.
What do we want?
Medicare for all.
When do we want it?
Now.
What do we want?
Medicare for all.
When do we want it?
Now.
What do we want?
Medicare for all.
When do we want it?
Now.